to the stage.
Good afternoon. Now, I'm sorry to disappoint you, I don't have any robots. This is going to be a very noble presentation after Martin's tour de force there. So I suppose the first thing I want to say is that I'm absolutely blown away with what I've heard in the last half hour. I cannot tell you how excited I am about this. It is, you know, for the first time I've been around a while now in terms of the reform side, but this is just absolutely amazing. And if much of this takes place, if some of it takes place soon and if it happens, this will be a really genuine transformation for the HSE. So congratulations to you, Martin, and congratulations to everybody involved. We're so happy to be supporting this in Innovation Week. So my role here, my short presentation, is just to tell you that we are absolutely centrally supporting your efforts in the HSE and in the health service for innovative solutions and digital transformation across the public service. And this happens to be Innovation Week. And the reason we designated an Innovation Week, and if you look at your Twitter, you'll see that we have quite a vast public service in Ireland. We have over 320,000 staff in our public services in Ireland. We have about 31,500 in the civil service, which is the governing service of the public service. But all of those people are really, really anxious to make their jobs better, to develop solutions for their customers. And we thought that if we had a week to showcase all of those, that we might actually get some momentum. And boy, there has been fantastic momentum in the week. And yesterday, as you say, was a really great event. So the Department of Public Expenditure Reform, albeit like that it looks like the Department of Finance and it's quite traditional, it is a very innovative department, and a huge amount has been done to support efforts across the public service to reform and to innovate. And in my role, I'm responsible for civil service renewal, which is, as I said, the governing sector of the public service. Even that simple construct is not always understood. We have a vast public service, and the biggest part of it is the health service, and then we have the education service, which is next, the justice sector, local government sector, and then the civil service is the, I suppose, central governing sector. So it's really important that the civil service is performing and that our policies and our support mechanisms are excellent for the wider public service. So I have a piece of government reform as well, you know, things like the Data Sharing and Governance Act, freedom of information, whistleblowing legislation and all that, but I won't be talking about that today. So just, I suppose, to walk you through briefly what I'm going to talk about, some of the evolution of reform from 2011 to now. And really, if we look back since 2011, it is fair to say that there has been an explosion of reform since 2011. The first stage of it, born out of the crisis. The second stage that we're in now, which is much more about organisation development and driving innovation and driving digital transformation. So the reform plan 2011-2014, that was our burning platform. I don't want to bring you back there, but that was a fairly dire time for all of us in 2011. So a lot of things had to happen fast, and there was a lot of structural reform, like development of the OGP, development of shared services, the structural changes across public service and civil service and so on. So moving on now, so we're in a much different stage of reform now. A lot of those structural areas have changed, and we have shared services in place. We have the Office of Government Procurement in place. Very importantly for this audience, we have the OGCIO as well, the Office of the Chief Information Officer, who I hope, Martin, is fully supporting all of your efforts in relation to what you're doing in the HSE. That's to bring, I suppose, central support to that. And all of that now is delivering reform right across the public service. So when we set about having a framework for reform across the public service, we have a very simple international model, which is that if you're in the HSE, if you're in a hospital, if you're in any organisation, even in your own workplace, there are probably three areas you should be thinking about. The first one is, how are you serving your customer? The customer, whether it's an internal customer or whether it's an external customer, how are you delivering for your public and how are you servicing your customer? So we have a range of really key actions across the public service. that are driving change, digital change, customer service, shared services, much better communication and engagement with our customers. We had a quality customer service network meeting in Farmley this morning, just come from that. And on the my far left, you have the internal organisation that drives that delivery to your customer. So it's quite a simple model. In order to serve our customer, we have to have a very smart, high-performing organisation. And they're the elements of a high-performing organisation: strategic HR, good workforce planning, good performance management and professional development. Now, much more diversity and inclusion, employee engagement, and understanding our culture and values. So if you would take that construct to the HSE, there's an enormous amount we can do across each of those actions. And the middle bit then is the dynamic capability, as I call it. How innovative are you? How, where is your leadership? Where are those intangible things in the centre that you can't access, but you know that you're there? Now, I can certainly say from hearing what I heard there in the last half hour, I would certainly say that you're definitely powering innovation and change, and there is leadership happening here. And it's a pity, I suppose, that sometimes that is not communicated to the wider public. It's quite a different message in this room, and it's quite a different message where you all work in the HSE. And it's the same for all of us, to what we hear in the media. But we will keep working to get the good messages out. So that's an international model put very, very simply. Think about your customer, look at your resources in your organisation, how smart they are, how you can deliver, and then look at the intangibles like leadership and innovation and data and so on in the centre. So now, and watching your presentation, Martin, we have now a Public Service Leadership Board. That picture is a little bit out of date. You see your former Director General, Tony O'Brien, there is on it, as well as the Secretary General of the Department of Health. So we've taken the big sectors across the public service and we bring them together 4 times a year, and we develop, we have particular items on the agenda, and we get them to push, whether it's digital, whether it's innovation, or whether it's customer service, workforce planning, whatever, and we're getting them to lead on the wider public service reform. So maybe, Martin, our next meeting in March, we might get some of what we got this afternoon to show the kind of digital transformation that's happening in the health sector. At our last meeting, we had all of the reforms that are taking place in justice. Now, you know that there's a vast amount of reform happening in the Department of Justice and happening across the guards, the prison service, and so on. There's been a huge momentum in the last 1.5 to 2 years, and we had that discussed at the Public Service Leadership Board. So we'll take the HSE perhaps maybe the next one, and that's Robert Watt, our Secretary General, who is a great leader for innovation, I have to say, and there's an extraordinary amount of innovation that has happened under Robert Watt's stewardship. And our Minister, Pascal Donoghue, who opened our conference yesterday, is a great champion of innovation, and he has set up and enabled us to set up an innovation fund. So they're just, I suppose, the kind of mechanism that you can link into to get greater support and, in time, hopefully, greater investment for your efforts. Now, there is one message that I've been giving to everybody this week in terms of innovation, and I'm glad, Minister, that you're here with us here, because you might hear this. If Ireland is to be successful, we must have a very good national system of innovation. Now, we spend enormous amounts of money supporting innovation in our enterprise sector, in our SMEs, in our multinationals, through Enterprise Ireland, through the IDA, through the Department of Business, Enterprise and Innovation, through Science Foundation Ireland, through the universities. We absolutely pour money into that sector, and that's as it should be. But at the very heart of our innovation system in Ireland is the public service. And we are very slow to invest in innovation and transformation in the public service. We are starved of investment and starved of support. And I'm saying that message very loudly all week, because I believe that in 10 years' time, when we come back here, we will be putting as much effort and as much concentration and investment into public service innovation and transformation as we now do to our private sector. Because we, at the centre of the system of public service, we're the regulators, we're the policy makers, we provide the infrastructure, we provide the leadership through government. We are actually at the centre of the innovation system. And yet all of our efforts and all of our investment are going directly to SMEs, directly to multinationals. So it's really, if you look at the national innovation system in other countries, the public service is at the heart of it. And I think we need to think a little bit stronger and a little bit better about how we support that and how we invest in it. And that's a message that we're talking to our Minister about this week. Now we've started an innovation fund in the reform, and thankfully the HSE has applied for it, and we're linking in with yourselves on it. So in terms of the action 1 in our reform programme is accelerating digital delivery, and there's a lot of things happening through the OGCIO. We're developing now a digital post box so that we can have all our correspondence with the government in one place. We have developed gov.ie, which is the national government portal. There's a huge amount of support for the different sectors digitally across the piece, and we have MyGovID, and we're developing a support system so that we can actually have a digital identifier to enable us to access public services. And obviously, it's well known that there are difficulties with that, but our surveys tell us that the vast amount of our customers want to interact with this digitally. So that's just, I suppose, some examples of what's happening centrally. So moving on very, very quickly, now, the big theme of this week is about innovation. That is our public service innovation network. And I know that you're very linked into that, and I'm delighted that you are. We have great interaction with that network, and the importance of that is that we can share across our sectors what each of us is doing in individual sectors, but equally we're providing the training and the supports for you and for all of the public service to help innovation, because there are particular skills involved in being innovative. Now you've heard the presentation earlier about digital transformation, but all of that starts with the business. It starts with the customer service, and how do we identify the opportunities for innovation and the opportunities for bringing this great digital technology to bear on solving our problems. So we're working very hard to, I suppose, roll out all of the training around innovation to make that happen. So we did a baseline review of our public service in terms of our innovation capability, and not unlike in digital transformation, we're fairly low in terms of innovation maturity across our public services. And our civil service survey, which we ran in 2015, 2017, showed us that innovation culture is one of the lowest measures of all of the measures that we measured in that survey. So we need to do something serious about this, because unless we're innovative, we won't give up with our customers, but equally we won't solve the big challenges that we're facing on a daily basis. So the Public Service Innovation Declaration, that has come from the OECD, so we're working with the OECD on various parts of this and linking in with other countries to find out how they have done it. But now we have an innovation team based in DPER, and Hilary is here from maybe you might stand up, Hilary. Hilary is here from the HSE, who is part of the wider innovation team. We also have an innovation fund, and we're going to be rolling out the fund again in January. You were awarded some funding last year for work. Now I think this coming up. St Columkille's Hospital got an occupational therapy department, and we had a real-time expenditure tracker. So they were just two small projects that got innovation funding from last year. So we would invite you when we come back in January and February, we'd invite you to apply for the Innovation Fund. And very importantly now, we're setting up an innovation studio in DPER so that you can all come in and work on your particular issues and your challenges, and we can provide the innovation expertise and the supports to you and the training to help you to solve those problems. So there's some of the wider things that are happening in terms of our innovation supports at central level for today's event. But I suppose importantly for me to finish now is to say that we have had a whole week of demonstrations of innovation. And to be honest, I have to say that this one has blown my mind. It has been absolutely fantastic. So I wish you very, very well with your efforts. And we will be connecting back with you to bring what you're doing here and the progress that you're making back to central government so that we can get even greater support for it and greater acclamation of the great work you're doing. So congratulations to all of you. It is absolutely wonderful. Thank you.